as if the heart knows that it is the last organ standing or that should stand, and so it doesn't just give up. By the time it gives up, it has been sick for a long time. Good day, everyone. This is Dr. Yakub, Wildlife Hospital, Abuja. Today, we're going to talk about something a bit common. We hear about it a lot, though it's not something that is palatable to hear about. We're going to talk about cardiac arrest. Now, what is cardiac arrest? I'm sure a lot of us have heard about it, but I want to clarify a few things regarding cardiac arrest. Cardiac arrest simply means that for some reasons, the heart of an individual has stopped beating. Of course, as we all know, right from conception, the very first and important organ of life and sign of life is the presence of heartbeat in an individual, right all the way back from the time of conception up until the time of birth. And of course, the heart will continue to beat every second, every minute, and every hour up until the end of life. So when the heart stops beating suddenly, for whatever reasons, then we say that the heart has arrested or cardiac arrest has occurred. And that almost always immediately means death. Now, this is different from cardiac failure or heart failure, whereby the heart is still beating, but is not able to meet up with demand for oxygen for the human body at the time. And that is considered as heart failure, not cardiac arrest. In other words, cardiac arrest almost always means death immediately if the individual does not get help within minutes. Whereas cardiac failure or heart failure does not necessarily mean death. The heart only beats maybe a bit slower, maybe with less force, so that blood flow in the body is impeded as a result of heart failure. So I think we need to clarify that. Now, what's the disease burden of cardiac arrest? WHO estimated in 2022 that all over the world about 19 million people died of things related to heart problems. 85% of those deaths were cardiac arrest. That's to tell you how common it is. And indeed, it is considered as the commonest cause of death among all causes of death all over the world. So it is quite common. And in these days, unfortunately, we seem to be hearing a lot more of people slumping at work, at home, at various places. More often than not, these sudden deaths may be related to cardiac arrest or heart attack. Now, what are the things that cause heart attack? Usually, before a heart attack will occur, there must have been certain things, certain predisposing factors that will make the heart disease to a point that it stops beating suddenly. And among these disease conditions that can predispose person to cardiac arrest, hypertension is one of them, diabetes is one of them, high cholesterol is one of them, sedentary lifestyle is one of them, obesity is one of them, certain medications, and then people who have conditions that predispose them to blood clots formation. So these are things. And of course, there are also people who may have a family history of some diseases that can predispose them to cardiac arrest. But by and large, those things I mentioned are the things that may have been present for a while, either knowingly or unknowingly to the person before the heart will just give up suddenly. So in other words, the heart will not just give up suddenly on its activity on you unless there is a process that led to it. The heart is almost always struggling to survive because knowing that as if the heart knows that it is the last organ standing or that should stand, and so it doesn't just give up. By the time it gives up, it has been sick for a long time. What are the signs? What are the early warning signs for any individual that may suffer cardiac arrest? Unfortunately, there are no specific things because some of the things that the individual may feel cause across other disease conditions as well. But by and large, things related to the heart usually will come in this form. Almost always, the person may realize or discover that when he or she attempts to exert himself or herself, then the person gets breathless. Breathlessness on exertion is one sign that may suggest that cardiac arrest is by the corner. The other thing that may happen is when you have chest pain. Chest pain, especially that is triggered by activities. If you attempt to do something and suddenly you feel a sharp pain, more so towards the left side of the chest, and particularly chest pain that tends to go towards your shoulder, left shoulder, or towards the left hand, and all of that, or sometimes towards the back. And this pain typically will subside when you rest. Then most likely that pain is coming from the heart, and it will be important that you check yourself out. The other thing that happens when a cardiac arrest is impending is breathlessness, sometimes even at rest, especially in the very severe cases of heart disease. The person gets breathless. In fact, small little activities can actually stimulate breathlessness, including talking, laughing, crying, and the rest of them. Of course, usually when that happens, it means that the heart is in such a very bad shape that you need to, as soon as possible, seek help. Now, if you also have risk factors for cardiac arrest, I've mentioned diabetes before, I've mentioned high cholesterol before, blood pressure problems, or you're on certain medications that may predispose you to blood clotting. Okay, it's important that you check yourself out regularly, because for some people there is no sign that comes to them at all except that they have existing or pre-existing risk factors. And for some unfortunate individuals, the very first sign of heart attack is that attack itself. And if they don't access, if they are not lucky enough to be in a facility that has capacity to revive them, in most cases it is very fatal. So what should we do? Now the first thing is, to prevent these things from happening, the first is identify whether or not as an individual you have those pre-existing risk factors we mentioned before. That is number one. If you have those risk factors, it is important you check yourself regularly. And these checks specifically for to exclude possibility of heart arrest or heart disease is a test called ECG. ECG is a test that monitors electrical activity of your heart. If the heart has risk factor for an arrest sooner or later, most cases ECG will pick it. Beyond ECG, there's another thing called echocardiography. Now, when you do echocardiography, it is a significant risk for heart arrest or cardiac arrest. It will be shown, and your doctors or healthcare givers will tell you what you need to do at the time. The other thing beyond screening is your lifestyle itself, because we've mentioned those risk factors. Obesity is one very important predisposing factor for cardiac arrest. So, controlling your weight, make sure that no matter what you do, your body mass index is not above 30. In fact, the ideal is between 18 and 25. That would significantly reduce your risk for cardiac arrest. In addition, avoid sedentary lifestyle. The longer you sit, the longer you sit in whatever it is you do, the more likely that blood clots will form in your body. And those blood clots are one of the reasons people develop cardiac arrest. Then the other thing that we encourage people to do is to avoid smoking, to avoid excessive alcohol drinking, because these are also risk factors that can predispose anyone to cardiac arrest. And then your diet generally. Healthy eating, there are certain food substances or food items that tend to predispose people more. Of course, in these times, the so-called fast foods, in whatever they come, they tend to have certain substances that predispose people to developing cardiac arrest. So the more you avoid them, the better for you. And so by and large, heart arrest or cardiac arrest is something that is very fatal. When it happens, even in the best of places, sometimes the individual may not be saved, depending on how severe the cardiac arrest is at the time it happened. So the best way to avoid dying from cardiac arrest is actually preventing cardiac arrest itself. And how do we prevent it? Identify risk factors. If you have them, try as much as possible to live a life that will modify this risk factor in favor of healthy lifestyle as against improving or rather worsening the risk factors. And then, of course, for those who have existing risk factors, it's important you check yourself regularly by screening, checking your heart every now and then when you have resumed. ECG is important, echocardiography is important. If you do this, of course, you have done your part as an individual, you leave the rest to God. And at the end of the day, hopefully, you should have been able to do something for yourself to prevent yourself from dying from the cardiac arrest. Thank you.